Good afternoon, class. My name is Megan Foote, and today we are going to be discussing hypertension. The reason we are talking about this is because hypertension is such a prevalent disease and it affects about 78 million adults in the U.S. Did you know that 1 in every 3 adults will develop hypertension during their lifetime? That's a scary statistic. What if I told you that in most of these cases this disease is preventable? Obviously, this topic is important to everyone of all ages. However, the older you get, the higher your risk of contracting hypertension is. In the U.S., people above the age 60 have a 65% chance of developing hypertension. This is a big health problem that our country is facing. However, the good news is that by making some lifestyle changes, this disease is very much treatable and preventable, so it is important for people to be knowledgeable about this disease. Before we dive into the topic of hypertension, we first need to understand what blood pressure is. We have all had our blood pressure taken and have heard the nurse say the 2 numbers associated with it, but most of us do not know what that means. Blood pressure is the pressure of blood against the walls of blood vessels or heart chamber. The heart pumps blood and creates a force. When the heart beats, we refer to it as being systole and the blood pressure rises. When the heart relaxes in between beats, we refer to it being diastole and the blood pressure decreases. Blood pressure is always rising and falling throughout the day, but when it stays high over time, that is when it is called hypertension. Blood pressure is measured using 2 numbers, the systolic pressure and the diastolic pressure. The systolic pressure is the higher and first number and is the pressure during the heart's contraction. The diastolic pressure is the lower and second number and is the pressure during the heart's resting phase. Normal blood pressure is when the systolic pressure is less than 120 and diastolic pressure is less than 80. Blood pressure that is consistently above 120/80 can be considered abnormal and a health concern. Now I'd like to address your attention to this chart of blood pressure for adults. As you can see, there are 4 different stages to hypertension. Normal is obviously less than 120 and less than 80. And then there's the pre-hypertension, and then the stage 1 and stage 2. And then if it gets any higher than 180/110, that's when you need emergency care. Okay, so now that you have an idea about what high blood pressure is and what it means, let's talk a little more about hypertension. There are 2 different types of hypertension. The first type, primary or essential hypertension, is what about 90 to 95% of the people with hypertension have. This is when the specific cause of hypertension cannot be identified. Some of the causes of essential hypertension could be diet, obesity, alcohol abuse, lack of exercise, stress, and genetic factors. The second type is called secondary hypertension, and this is when it is caused by a different problem going on in the body that causes you to be hypertensive. Normally, when you treat that problem, blood pressure will go back to normal and you will no longer be hypertensive. There are various reasons why someone would develop hypertension. Most people that develop hypertension have a combination of risk factors that contribute, such as stress, obesity, high sodium diet, lack of exercise, and consuming too much alcohol. There are factors that are out of your control, including race, age, and heredity. Several body systems and organs are negatively affected by hypertension. With high blood pressure, it causes arteries to stretch more than they should, which can lead to damage or blood clots. High blood pressure also makes the heart work harder and pump more blood, which over time will weaken it and can lead to heart failure. The brain, the kidneys, and eyes can also be damaged from high blood pressure. So now that we understand the disease and its causes, let's take a look at ways we can prevent and treat it. There are some things that people with hypertension can do to lower their blood pressure. People should try to keep a healthy body weight to reduce the stress on their heart. Lowering sodium intake is another way to treat or prevent hypertension. Also, by limiting the amount of alcohol consumed each day can help with hypertension. Eating a healthy diet each day, such as the DASH diet, is another good way to combat the disease. So now I'd like everyone to take out their handout that I passed at the beginning of class. This is a sample DASH diet menu. These are just like sample meals that someone would eat if they were on the DASH diet, and they include mostly fruits, vegetables, and low-fat to no-fat dairy, and they also include lots of fiber, and it's an easy way to lose weight, and it's also a way to help cure hypertension without having to be on medication. I hope that you learned and understand what blood pressure and hypertension are. The main ideas you should remember are that hypertension is a treatable and preventable disease. It is caused by high blood pressure that is consistently too high. Although this is a scary and potential disease, it is important to know that people can prevent it or treat it by making some healthy changes in their everyday lives. Thank you.